And this is like Thursday, it means election speaker series. And that's why we have Valda Crowder this morning. So I'll give you a little bit of background about this amazing woman. I even learned more, even though she is on my gun violence prevention task force. Wow. This lady, she's been around the globe. Dr. Crowder, she's a board certified emergency medicine physician who has had more than 30 years experience. Look at her, 30 years? She did her undergraduate work at Cornell University, then trained at the University of Cincinnati Medical School, and completed her residency in emergency medicine at William Beaumont Hospital in Royal Oak, Michigan. Dr. Crowder recognized early on the importance of merging medicine with clinical, with business and public health areas. Thus, she studied business at the Wharton School of Business at the University of Pennsylvania. She is currently with the Capital Health Partners in Bethesda, Maryland. She serves as national chair of the Health Committee of Black Women for Positive Change. Since March 2020, she has been hosting webinars most Tuesdays and Thursdays at 8 p.m. So at 8 p.m. on a Tuesday and Thursday in DC, Valda is there informing the public about the latest in COVID-19 and answering their questions about the virus. After graduating from one of the first classes from medical school in the specialty of emergency medicine, she helped define emergency medical care, writing articles, a textbook with colleagues, and advising the research team for the hit TV show ER. Awesome. Dr. V, as she is referred to, has treated patients in 4 pandemics: COVID-19, in HIV, tuberculosis, and malaria. Further, she has provided medical care in gun violence incidents, a mass shooting associated with the U.S. Postal Service, and a natural disaster, Category 4, Hurricane Maria in 2017. More recently, Dr. Crowder has worked to re-engineer large healthcare systems that have included Cooper University Healthcare System, Camden, New Jersey, Corazon Health, providing healthcare to incarcerated inmates nationwide, and the National Football League to address violence-related issues. Well, moreover, I am so pleased that Valda is a member of WNDC and serves on our Gun Violence Prevention Task Force, as I mentioned earlier. I am pleased to welcome Dr. Valda Crowder, who will update us on medical information related to COVID-19 and help us in developing a COVID action plan during the election season. Valda Crowder, take it over.
Thank you, Ellen. Thank you for that great introduction. All righty, let's get started with the slides because I have everything sort of, is Amy, you're actually doing the screen share?
Yes, I am. Give me just a second.
Okay. All righty. Sounds great. All right. So what we're going to do is I've got a series of slides while Amy's putting that together. I've got a series of slides that we're going to kind of go through. One thing that I really ask of everyone is to really suspend what you know about COVID-19. There is an article that's being published today by Cornell University. They went over 38 million articles about COVID in the English language. And the #1 misinformer of COVID-19 was Donald Trump. And sometimes we do not even realize how much we've actually been exposed to misinformation until we kind of clear our brain and kind of look at things newly. So we're going to talk today about developing a COVID action plan during the election season. A lot of the source documents for this is on askdrv.us. That's my website. Also on there is an invite to any of the webinars. They're done every Tuesday and Thursday, and I'll be doing them every Tuesday and Thursday until we have a vaccine. All right, let's go to the next slide. All right, so the intention of the outcome is to provide scientific clarity to COVID-19 information that will help you and your family develop a plan to vote as safe as possible during the COVID-19. If you could, thanks. The outcome, you'll leave the webinar motivated to create an action plan for yourself and your family. Some people will be motivated to create an action plan because they may be in charge of a broader community. You may be in charge of a homeowners association or a school or a job site or a union. Go ahead. All right, so let's start off at the beginning. What is a pandemic? A pandemic is any new disease that is contagious that we do not have immunity to. So a lot of times you hear in the news, you know, it's been 100 years since we've had a pandemic. It hasn't been 100 years. Okay, the last pandemics were HIV, bird flu, SARS, MERS. If you go back a little bit further, smallpox, polio, tuberculosis, right? So many of us that are actually listening now have actually survived pandemics. Go on to the next slide. Now, why is it called COVID-19? And if you could just click through this one at a time. CO is corona, and it's Latin for crown, because when you look at that molecule on the right, it looks like it has a crown or a halo around it. VI is for virus. D is for disease. 19 is 2019, and that is the year that the strain occurred. There's not 18 other coronaviruses. There's thousands of other coronaviruses, but this is the one that actually occurred in 2019. And hence you get the name COVID-19. All right. So why is this so important? We've all experienced a pandemic before, and some of us have experienced more than one. So basically, the final outcome are one of two things. One, we either get a complete cure or a near complete cure, think polio, smallpox, or we get some sort of containment, right? HIV and also tuberculosis, right? Some sort of containment with some sort of management of the actual infection, all right? So that's where this actually goes. Now let's keep on going. We'll talk a little bit about coronavirus. So coronavirus is spread people and surfaces. It's small droplets. They can become airborne when people cough or exhale or speak or sing or blow an instrument. It can also land on surfaces, and there also can be contact. Go ahead to the next slide. All right, so it stays on surfaces, cardboard surfaces for 24 hours, plastic or metal surfaces for 96 hours. That's very important. Go ahead. It's highly contagious. So how is that calculated? How much time do you need to be exposed to COVID-19 to get it? COVID-19 is 45 seconds. The other thing we look at is if 100 people were exposed to COVID-19, how many of them would come back positive? For COVID-19, that's 60 to 80% of the people would come back positive. And that's about twice as many as would come back positive for the flu or the common cold. Go ahead. So there was a lot of talk about droplet and airborne, and it looks like COVID-19 actually is transmitted as both. And so we initially thought that it was only droplet, but we have found that it breaks up and actually does, and is still infectious in an airborne sort of state. So that's why the initial recommendation was 3 feet, and now it's 6 feet away from each other. This is just an example of what a droplet looks like, which is like Ebola, versus what an airborne transmission looks like, which is measles. And so it's very, very important in certain arenas, particularly like singing or any sort of instruments. Those airborne particles can stay in the air for 30 minutes and can travel 1 to 2 miles. So let's take a look at the symptoms of COVID-19, because the symptom clusters actually tell you a little bit about how severe things will be. Go ahead. There's 6 basic symptom clusters. One, you can have flu-like symptoms without a fever. You can have flu-like symptoms with a fever. What is often missed, and what people often don't recognize, is that COVID-19 does not present only as a respiratory disease. It can present only with nausea, vomiting, and diarrhea. And that is cluster 3. Then you can have similar symptoms of flu with fatigue, similar symptoms of flu with confusion, and then there's a sixth cluster where you basically have all of the symptoms combined, the nausea, the vomiting, the abdominal pain, the respiratory symptoms. So cluster 1, 2, and 3 are usually treated at home. 4, 5, and 6, where they get the fatigue, confusion, or have all the symptoms together, are the ones that usually get hospitalized, may wind up in the ICU, or die. It's very important to remember that asymptomatic people can spread the disease. So a lot of people are thinking, I don't want to be around anybody that's sick. There is a significant amount of asymptomatic spread with COVID-19. A lot of people talk about COVID-19 deaths, and one of the things that I want to talk about is those that live, because there will be a lot of people who will be living with us after this who have had COVID-19. There's what we call post-intensive care syndrome. 75% of the people coming out of the ICU with COVID-19 actually experience this. And what this is significant cognitive, mental, or physical impairment. So it looks like either renal failure requiring chronic dialysis or transplant, limb amputations, strokes. You have about 50% of young people who have a stroke and cannot return to work. Decreased lung capacity. 30 to 35% of people actually complain that they can't walk a block or do normal house cleaning afterwards. We've had some young people already who've had COVID-19 who've had to have double lung transplants. So I tell people because of that, it's not a good idea to actually just catch COVID-19. One, it does not, if you catch it, you do not get lifetime immunity. You can catch it again, and we have had documented cases of people already in the United States and many, many hundreds in Europe and also Asia who have actually caught COVID-19 for a second time. So it's not a good idea to have these COVID parties or catch it again because of the risk profile and also because it doesn't provide lifetime immunity. So let's talk about kids, because there's been a lot of talk about kids. The largest study on children was actually published in Lancet. It was a multi-center study. It was published maybe actually the 1st of September. And it was 82 institutions across Europe. And they actually reviewed 582 confirmed pediatric COVID-19 cases. The cases were patients that were 3 days old to 18 years old. And the average age was 5. So this was essentially school-age children. What they found was 65% of the children had a fever, 35% of them did not. 54% of them presented with basic sniffles, sniffles, cough, that sort of thing. 22% of them, which was fairly high, had only the nausea, vomiting, and diarrhea. And I reiterate this because often if a child has nausea, vomiting, and diarrhea, a teacher or a parent may not possibly recognize that as possible COVID-19. 28% of the children only had a headache, no other symptoms, just a headache. And then 25% of them actually presented with wheezing, coughing, and respiratory symptoms as we normally know them. The other thing that you see in children is what we call COVID toes. And this is kind of a reddish bluish discoloration of their toes. The parents think maybe their shoes are too tight. In the wintertime, they think maybe they have their toes are frostbitten. If they call the emergency department and describe this to us, we tell them don't even bring the child to the emergency department. They have COVID and begin to quarantine. What are the outcomes for the pediatric population? 62% of the children that had COVID-19 required hospitalization. This is in Europe. 8% of them required being in the ICU. 4% of them actually required being on the ventilator. 3% required what we call inotropic support, which means their blood pressure was low and we had to support their blood pressure. And 0.7% of them actually died. Now, I just want to say these are better outcomes than we expect to get because of 2 reasons. One, in Europe, all the children are insured and they all have insurance and they all have access to healthcare, which is not the case in our communities universally throughout America. The other reason why we would not expect to have outcomes that are this good is because we have a childhood obesity problem. And obesity is a significant risk factor. And in Europe, they do not have that problem. So these outcomes, I don't think that we will actually have outcomes that are as good as this. So let's talk about prevention measures. So how do you prevent getting COVID-19? How do you prevent spreading it? And what happens if I or my family gets it? Okay. There's been a lot of talk about hand washing. I just tell people we spend almost 2 months in medical school learning how to wash our hands. Most of us wash our hands and only do slide number 1, which is palm to palm. And usually you do palm to palm. You may shake your hands dry, maybe you dry them a little bit, and you go on about your business. I want to just actually washing your hands is slide 2 in between your fingers, the back of your hands, the base of your thumbs, the back of your fingers, your fingernails. Washing your hands includes your wrist. And most importantly, it includes wiping your hands so they're completely dry. Wet hands actually pick up a lot. Now, social distancing, the power of social distancing. So the way we were living our life back in January, February, before this shutdown, one person infected by COVID-19 would infect 406 people in 30 days. So when you do a shutdown, and if you do a 50% shutdown, then that one person infects 15 people. If you do a 75% shutdown, then that one person infects 2.5 people in 30 days. So as you can see, we were really in trouble in March without actually shutting down. Wearing a mask. I think, what I tell people is in real life, we don't know who has COVID and who does not have COVID. But in this particular example, we're going to assume that the person on the left has COVID and the person on the right is healthy. So if the healthy person wears a mask, the likelihood of transmission is 70%. If the COVID-19 person wears a mask, the likelihood of transmission is 5%. If both people wear a mask, the likelihood of transmission is 1.5%. So that is fairly significant. All right, and just to go over masks just real quickly, the N95 mask was invented by Tsai, and basically it is fabric on the outside that electrostatically, like a magnet, attracts particles. And that's why it's really, really important not to touch the outside of the mask itself and to only really touch around the areas that go around your ear. His recommendation is to get 7 N95 masks and use 1 for each day of the week. I looked up on eBay how much they were, and you could get 7 masks for about $35. I looked at eBay and also Amazon. Hanging each one up at the end of the day, it'll sit for a week, which would allow any virus to deactivate before you actually come back to it again. So you could use 7 masks, and you could probably use 7 masks for about a month and a half to 2 months. Quickly on risk factors. I know there's been a lot of talk about risk factors, and I want to just clarify a couple of things. They talk about the elderly. Now, elderly, we're all as young as we believe we are, but the risk factor actually is if you're born on or before 1955. The other thing is if you live in a nursing home. Chronic lung disease and heart disease we know about. Immunocompromise includes people with cancer that are in the midst of cancer treatment. And also any sort of disease that impacts your immune system. So lupus, sarcoidosis, HIV. The other thing that I think a lot of people don't understand is obesity is a risk factor at any age. This is where we're particularly having problems with our young people because they think they're young and they're healthy. And obesity by the CDC is defined as a BMI greater than or equal to 40. You do not have to have high blood pressure. You do not have to have diabetes because obesity in and of itself is an inflammatory state, and this is an inflammatory disease. The other risk factor is pregnancy. All right, so just BMI greater than or equal to 40 is someone who's 5'2" and greater than 220, 5'6" greater than 250, and 6 feet greater than 300. So as you can see, this would actually be really a problem. This is really a problem in the arena of football. Right? Or sports where you have heavier people playing those sports. Go ahead. Other important risk factors, people with blood type A, we don't know exactly why, but they're more vulnerable to COVID-19. Those with blood type O seem to have a significantly lower risk of catching the disease or having a significant sequela from it. The other thing is smoking and vaping. 40% of the people hospitalized that are young people have a history of smoking and vaping. I really recommend that during the pandemic, people quit smoking or vaping. Men are also at higher risk of actually getting COVID-19. We don't know exactly why, but they're more likely to catch it. And once they catch it, they're about 40% more likely to die. So, and that has been consistent throughout China, Italy, and we're seeing it here in the US as well. One of the things that I recommend is that it looks to me like there is facial hair. One, it actually is a place that the virus can kind of accumulate. And then also two, if you have facial hair, your mask doesn't fit as well. So my recommendation is to get rid of facial hair during the pandemic. The other thing that's important is a lot of people have home nebulizers. If you have an asthma attack, you can't distinguish whether or not you're having an asthma attack or if you've had a COVID-19 attack. So if you have a nebulizer and you live at home with other people, you need to use that nebulizer outdoors or in a garage with the garage door open, because if you use it indoors, it'll actually spread the COVID-19 all over the air in the home. You can also use an inhaler with an arrow or spacer chamber as is shown here, and that is another way to avoid infecting others if you have a nebulizer. So no indoor nebulizer use. This is just a risk chart. This was put together by the Texas American Medical Association. I really like this because it kind of grades things from high risk to low risk. So high risk is attending a large music concert, a religious service, and it's important. That includes weddings and funerals. I really recommend doing them by Zoom. Going to a bar is also a high risk. Eating at a buffet, working out at a gym, a movie theater, sending kids to school, camp, or daycare, working in an office building, swimming in a public pool. Getting a little lower is going to the beach or shopping at a mall. If you go a little bit lower, then you're staying at a hotel or eating at a restaurant outside. Lower is grocery shopping, running, walking outdoors. Getting restaurant takeout and pumping gas is very low. Playing tennis, my favorite thing. And then they have as number one, the lowest thing to do is opening your mail in your own home. So, all righty. Now, what happens if you found out that you are COVID-19 positive? One, you need to quarantine immediately, preferably for 21 days. They found that people after 14 days are still positive. These are the things that you actually need to have in a quarantine room. And I tell people it's very important to actually have it ready. You can get a pulse ox from Amazon for about $25 to $30. That's basically to measure your oxygenation. The issue with COVID-19 is people get short of breath, but they don't feel short of breath. So we call them happy hypoxics. So it's very important that if you have COVID-19 that you check your oxygenation. If it's less than 95%, you go to the emergency department. I recommend that everybody has zinc and vitamin D3. That is important supplementation to take during this pandemic. The other thing is you want to have a bathroom that only you access. You want to have your cell phone so you can call for help. When you call for help, you are not calling other family members, you are calling 911, because if you call other family members, you will infect them. You want to have food delivered at your door, and you want to keep your windows open and use HEPA filters in your HVAC system so that you're not spreading it around the house. How to win against COVID-19. Early detection, early response is the best way. Also, we use in the emergency department, and I tell everybody, use universal precautions. And that is basically this. I assume I have COVID-19. I assume you have COVID-19. I assume you have COVID-19. And you assume I have COVID-19, and we all act accordingly. All right, so planning your vote. Let's go. Number one thing to do now. This may shock everyone. Get a flu shot. Now, you might say, why? Well, one of the things that is important on the flu shot is that it takes, if you get a flu shot today, it takes 2 weeks before the flu shot becomes effective. And people who are actually going to get into trouble are people who are going to catch COVID-19 and the flu. So get a flu shot now. Number two, buy an N95, KN95, or N99 mask. And any one of those would be fine. So the number at the back actually tells you what percentage of particles it blocks. So 95 mask, whether or not it's N or KN, blocks 95% of the particles. A 99 mask blocks 99% of the particles. The regular mask that you see people wearing where they either made it at home or whatever is about 50% effective, okay? All right, and this just shows you a picture of what that it looks like. You can buy these if you're in the Washington, D.C. area. Mac Market on MacArthur Boulevard has these all the time. And you can get a package of about 2 for $6. You want to make sure to get one without a valve, the one to the right with no valve. Those are the ones that you actually want to get. Do not use neck gaiters. These are the sort of almost like a cow neck that people are using, and they pull it up and pull it down. This has actually been shown to increase the transmission of COVID-19. Number 3 thing to do now, bring your own chair, water, snacks, hand sanitizers, and wipes to the polls. Now, this is really important almost any time. I tell people whenever I work on election day, it's like, you know, it's like Pass Out Tuesday. It is the day where everybody passes out at the polls. That's on a regular election day. On this year, where we've got, you know, a lot more people voting, I think it's going to be even more important to bring your own chair, your own water, snacks, hand sanitizers, and wipes. Best strategies for voting. The best strategy is if your state actually has drop boxes. I know Maryland has drop boxes. DC does not. I have not seen any drop boxes in DC. But if your state has drop boxes, that is the best option. You're not dealing with the Postal Service. You're putting it in the container, and it's going directly to the Secretary of State. The other option is if you actually have, there's some states that allow you to drop it off at the Secretary of State's or a clerk's office, or allow you to actually drop it off at the polls. Early voting, if you're going to early vote in person, I recommend that you actually go first thing in the morning. The reason why they have sort of senior grocery shopping early in the morning is because with less people in the store, items haven't been touched. There's not as much in the air. Things have been sitting overnight. And lastly, if you actually decide to actually go vote on November 3rd, please make sure to use an N95 or a KN95 mask at a minimum, as opposed to homemade mask or surgical mask. Please invest in an N95 or KN95 mask in order to go to the polls. All right, I want to talk quickly about some good news. This here is a home COVID test that they have tested in Australia. It almost works like a home blood sugar test. So you can actually do this at home, determine that you're negative. It has a date on it, and they're using it to actually get theaters and concert halls and movie theaters back up and running. So you would actually bring your ticket as well as your strip showing that you're negative. These contraptions are $3 to $5, and I think they'll go a long way towards helping us actually get life back to normal. The other thing is that our furry friends are actually more accurate than COVID tests. They have been able to train dogs to actually sniff and detect COVID-19 positive, and they primarily used it in the airports to sniff out travelers that are, but there's no reason why it couldn't also be used in schools, etc. But they are more accurate than COVID-19 testing. And lastly, I want to thank everyone for the sacrifice that they've actually made in their lives around shutting down. We have actually, as a result of the things that we've done with social distancing and shutting down, I know it's been a significant economic and personal sacrifice, but studies have shown that we've actually saved 60 million COVID-19 cases that did not occur in the United States. And that would have been easily easily another 200, 300,000 deaths. So I want to thank everybody for the sacrifices that we have made. It really has made a difference. Sometimes you don't see what didn't occur. Stay alert and stay informed. There's always local government alerts. COVIDactnow.org is a website where you can actually see what amount of infection is in your county. They color coded yellow, green as in good, and yellow, orange, red. World Health Organization is also a very good site. My webinars are every Tuesday and Thursday night, 8 a.m. to 9 p.m. Eastern Time. They're free. The invite is at askdrv.us. Once you go in and participate once, then you'll get an email every week, and you can get on whenever you like. And I think that is the end, and I'll take questions and answers. Yes, respect COVID-19.
Thank you so much, Dr. Crowder. This was very informative. I have already a question, and that is, I and the staff at the WNDC go and get ourselves tested almost every 2 weeks. Sorry, every 4 weeks. And I want you to know that we go in DC, and each time we get ourselves tested, the test is a little bit different. Sometimes it's more invasive than other times. Are there good tests and bad tests? Should we be mindful of that?
Yeah, so there's basically two types of tests. There's a PCR test, which is a more invasive test. That's the one where they really cram it up your nose, right? And then the other test is a rapid test, and the results come a little bit faster, right? So the rapid test, which is less invasive, is wrong about 20 or 30% of the time. So it's usually wrong if you have COVID, it'll tell you that you don't have COVID. So it's a false negative, right? So the rapid test is the one where they cram it up your nose. Unfortunately, even though it's uncomfortable, it actually is the more accurate test, right? What we do in the hospital setting for the rapid test, because it has so many false negatives, is we get 2. But in your situation, you're taking it just to check every once in a while. You're not actually taking it because you have any symptoms.
Right.
Yeah. So you're probably fine with either one.
Because we went, Pat and I went about a week ago, and now I'm getting everybody to go again, because we are more exposed to people now than we were, let's say, a month ago or 2 months ago. And I just think for everybody's peace of mind, we've just got to keep doing this if we're going to remain open at any level.
Yeah, and if you want to do it and really be more exact, you'd get the one that's more uncomfortable, unfortunately.
Yeah, I know, but we can't order that. They decide when you go.
They decide. Oh, okay,
they
okay,
decide
all right,
there.
okay.
So we don't have an option. We
switching,
just know how it feels, right?
Yeah. I got you. Yeah. So they're switching back and forth between the different tests then.
Right. So. Carol Rogers, who has a question on masks. Carol, why don't you unmute yourself and ask?
Yes, hi. First of all, thank you so much for this really excellent presentation. And I have already flagged your website and will tune into your webinar as well. I have a question about masks. We had been told not to get the N95 mask, etc., because they were in such short supply and were needed for healthcare and other frontline workers. And so it seemed to be like a sign of respect and whatever to be wearing our own homemade mask, etc. So you're suggesting that we should be wearing now the N95 or KN95, whatever. So are they now readily available enough for healthcare workers and others that that's not an issue?
Yeah, so we now, I have not worked at any site recently that has had a problem actually getting the N95 or KN95 mask. And that's another problem that to me, it feels like it was sort of manufactured there's plenty, you know, Larry Hogan is married to someone who is, his wife is South Korean. They flew to South Korea and brought back a whole plane full of masks. So I think that whatever was happening there was really more related to our administration and how maybe they were interacting with these foreign governments. But whatever that was, we have not seen PPE shortages anymore at the hospital. I haven't at any of the hospitals that I've worked at. I haven't seen any PPE, and I haven't heard of any PPE shortages. So, and I see the mask now at the Mac Market and other little stores that I go to. So I would use the best mask that I could get my hands on if I was going to go vote.
Okay. May I just also, and I put it in the chat, here in the district, we got our mail-in ballots already, and
Yes.
the drop boxes are being installed on the 5th, it says,
Okay.
all around the city, and there are like maybe 10 in every ward, and you can drop your ballot off at any one of them. And so it'll be
Okay.
really easy and safe for those of us who either want or need to vote using our mail-in ballots here
Good.
in DC.
Here in DC. Okay. All right. I was wondering about that because I know Maryland had the drop boxes and I just hadn't seen them yet in DC.
Right.
So good to know. Yeah. That is really the best way because that is outside of the Postal Service and that goes directly to the Secretary of State.
We have questions here, and I'm going to encourage people to just unmute yourselves, Judy and then Stephanie.
Oh, this was wonderful. I have so many questions. Where do I begin? I just looked up the address for the Mac Market on MacArthur
Yes.
Boulevard.
Yes.
So you said, so we'll look for those.
Yes.
And the second
They're
thing,
right at the cash register. They're right at the cash register, like the candy.
really, I mean,
Yes.
that's incredible. Well, the other thing, you mentioned that that test from Australia. Is that available here?
No, it
That-
is not.
That home
No, it isn't.
test? Well,
No.
well, our government certainly wouldn't think of ordering it.
Right. Right.
But I mean, is that widely known? And will it become available?
Yeah, so there is another rapid test that the NBA and the NFL is using, and that's how they've actually gotten those sports started again. It's not quite as rapid as the one in Australia, but it's pretty close. But it still requires you to actually send something back to the lab, right? The issue with that one in Australia, which is really great, and Germany also is has one. They just started back doing large concerts. They did a big study where they did a large concert with like 1,000 people and used this, and they're seeing whether or not they can do this successfully. And so I haven't seen either one of these available yet in the United States. But I haven't seen the studies yet come out. They're doing the studies, but I haven't seen the results of the studies yet in the literature.
Well, I have so many other questions, but yes, I'll let other people ask them.
Okay.
Thank you. This was
Yeah.
wonderful.
Okay, so let's see. How about Stephanie and Ellen and Nancy?
Thank you so much for this wonderful presentation and Dr. Crowder's wisdom. I had one question that was related to the test in Australia that I believe has been answered. I suppose we need to just find a friend who's going to Australia to bring some back.
I'll go.
Right.
I do have a few contacts there. I'll be reaching out. But my other question was related to using aromatherapy in the form of oils or sprays inside of the mask to make it more, I guess, bearable for long-term wear. And I am a nurse, and there are other colleagues who are using different aromatherapy blends so that breathing that repeat air is a little more tolerable for longer hours of time. Thank you so much.
Oh, great to know. Okay.
Okay, who wants to go next? Ellen? Or Nancy?
I'll go if Ellen's not ready. First, for levity, I'm going to share a little comic. I don't know if you can see it.
If you hate wearing face masks, let's see it again.
You're going to really hate a ventilator.
So I'm sharing because I'm an anesthesiologist by training, and Dr. Crowder knows, we know vents. We know vents.
Yes.
And I got your name and your information. I'm actually down here in Florida. Judy Shecklin gave me it through Ellen. So thank you so much for allowing me to eavesdrop. I did learn a lot already, even though I've read a lot about this, and I have some specific questions for you, Dr. Crowder. Here in Florida, we are as purple gets, as you know, and I am volunteering to be a poll watcher. I will definitely have my N95 masks, but I'm in the process of demanding that our local county supervisor of elections provide N95 masks for all poll workers, because we have a significant problem with people who refuse to wear masks. And this is indoors without adequate social distancing. So I think it's a very reasonable request. I'm just wondering what your thoughts are with how to deal with the question of, this being potentially voter intimidation. I know you're active politically and you've been a poll worker, and just dealing with the problem of mask compliance per se.
Yeah, so let me just say, one is, if I was in Florida and going to be a poll worker, part of this disease, the issue is how long are you actually exposed to it? So the length of exposure actually makes a very big difference. So that's why you see sometimes where ICU nurses get particularly sick, because they're in the room with the patient for a much longer period of time, right? And so if I was going to be a poll worker, I would actually get an N100 mask. They're on Amazon and eBay. They're by a company called Sperian. I'll actually put it in the chat box. It's a respirator mask, and it's about $89. So it is that is what I would use if I was going to be a poll watcher. I also use that type of mask if I'm going to fly, although I don't fly now. But if I had to fly for some particular reason, I use that. And I also use it in the emergency department. It's a little bit easier to breathe. It has carbon filters on both sides. It has the holes on both sides. And it's made of silicone. And those masks, like I said, they're about $89. If I was a poll watcher, I would actually use that.
Yeah,
I don't think I'm going to get them to
you won't get them.
those.
So how long do they last? They cost a lot of money. How long do they last?
Oh, those last. Those are silicone. They last forever.
I see. And could you also in chat put down the name of the place where we can go over the counter and buy the N95s?
Yeah, that is Mac Market.
MAT?
On MacArthur Boulevard.
Okay, great.
But yeah, I think
185 MacArthur Boulevard.
Yeah, exactly. Yeah. Right.
A little shopping center at Arizona Avenue.
Yeah, there's a Wells Fargo, there's a Starbucks. But yeah, I think that for the poll workers, I would say, if you're going to be a poll worker, even if the poll workers got together and if you put $100, the masks get cheaper the more you buy. So, if you put $100 together amongst 10 people, you could probably with $100 get almost 20 masks. 20 N95 or KN95 masks.
Yeah, what I'm hoping, they did get extra money with the CARES, and so they were going to offer extra pay to the workers. The workers tend to be older and frankly, sometimes need the money, to be totally honest with you. So I'm not thinking they're going to be willing to spend that much for a mask, but I think at the very least we need to have extra masks there to give to any voter who shows up and doesn't have a mask. But I've been told that as a constitutional right, it supersedes any other mask law. We have a mask ordinance in my county, which we pushed for with a bunch of other doctors, and we got it, Jacksonville here. But in a lot of other places in Florida, there isn't even a mask mandate. So the poll workers themselves don't have to wear masks. So it's just, when I tell you my head wants to explode someday. So I hope you all appreciate how good you have it there in DC, and I'll end on that.
So let me also say something, because some people have been actually have asked me about gloves. And what happens with gloves is people, because they don't really know how to wear gloves like we do in medicine, they often self-contaminate. So the glove gets contaminated and then they touch their face or whatever and they contaminate themselves. So I tell people, don't wear gloves, don't buy gloves, just buy the hand sanitizer and just hand sanitize, because you're more likely with the gloves to self-contaminate. So if you're looking at how to spend money, mask, not gloves.
Bonnie has a question. I think Ellen wanted to say something, and Pat Fitzgerald has a question. So who go? Just somebody.
Ellen, I'll jump in.
Okay.
It's more, maybe more broadly than just the election, but I will say to Stephanie, my son has just started his doctoral studies in Florida at the University of Florida, Gainesville. And yeah, he's been telling me all about Florida, but he's also said, look to the university reporters wherever you are, and like at Gainesville, that they've got the information, the data, whereas the university president, and of course your governor, does not. And what he has, he blocks. But the students are really being transparent. They know what's going on. They know where COVID is. They know where the tracing is. Anyway, it's a great resource. But I was just going to go and push on to like the holidays and winter. I mean, we got the flu, we've got COVID. What do we do now as people are going more inside, like in the club and our other activities at home, trying to get with family or friends if we can?
Yeah, so it's really important. I'm really recommending that people not have large family gatherings for Thanksgiving and Christmas, because one thing about COVID-19 is we actually wind up infecting our family and friends, and people actually die in family clusters. So it's very important, you know, I tell people, if you've been actually already in contact with a certain number of people or with certain people, stay only in contact with those people. Don't bring in other folks. I do think that, you know, if you decide that, you know, some folks are getting COVID testing, if you do the rapid test where it doesn't hurt as much, please get it done twice before you actually assume that you're COVID negative. So for some folks, they're getting COVID tested and then they're getting to go visit with family members. And that is one way to actually do it, assuming that they have access to that. As far as the wintertime is going to be really, really difficult. You know, what's going to happen is you have not only influenza, but you also have a virus called RSV, which is in the wintertime. And that, along with COVID, all three are respiratory diseases. And the people that really get in trouble are folks that actually catch both together. And in the wintertime, people are going to be less likely to sit outdoors and do things. So like for myself, I'm actually going to REI and I'm trying to get, you know, all sorts of different materials so that I can be warm and walk outside. So maybe I can be warm and sit outside and have coffee. And so I'm telling people to sort of prepare like that. But we are going to need to stay in our homes and then just outdoors, but not go into restaurants, bars, gyms, churches, anything like that in the wintertime. We need to stay away from office buildings.
Pat and Nancy, and so Pat, let's go with you.
All right. Thank you so very, very much, Dr. Crowder. You're amazing. And I can't wait to share this video because it has so much pertinent information. I thank you.
Yes.
But my question is, I have these masks that they're printed KN95. I'm not sure. So when I'm around others, I wear this white KN95 mask, and then I put my homemade mask on top. So I'm wearing two masks when I'm around others. And so I just wanted to know, is that overkill?
The mask that's on top of the N95 mask really isn't doing anything. So let me actually describe, if we were doing this correctly, right? Okay. This is what we would actually do. Okay. There are many, many, many different types of N95 masks. Okay. And what we do in the hospital is we as physicians get fit tested, right? So what that is they put us in a hood, we put on one mask, and they put in something for us to smell, right? And they determine if we can smell it or not. And you try on the different types of masks until you cannot smell whatever they've actually put in the hood that you're in. Okay. All right. Okay. So you could do this at home, right? And I actually had on my webinars, I had everyone set themselves up so that they could actually do this. They didn't have a hood, but I had them have something, whether or not it was perfume or bug spray. I had them actually spray it, put on their mask, spray it, and see how much they could smell, and then put on a different mask, and then put on a different mask. The mask where you cannot smell is the better mask.
Okay. Understood.
Okay. All right. So the KN95 and the N95 mask, they usually come in different plies, like 2-ply, 3-ply, 4-ply, 5-ply. You don't usually see them more than 5-ply. Right? So the ones that are up at Mac Market, they have 5-ply, which means 5 layers, and 95 masks, right? And so when you put those on, you really should not be able to smell, but you might have to play with different brands to get the one that works the best for you, right? But like, for instance, I know I'm an N95 1870 plus. So that's like saying I'm an N95 and I'm a, I don't know, size 4 long, right? Right? If I was talking about clothing or something, right? So you wanna actually play around with the mask and actually look at which mask am I not able to smell. That's the mask that you actually wear.
All right.
Stephanie, do you want to ask your questions?
Me? I don't have any questions.
Yeah, I can.
Yes.
I was wondering if anyone else uses a UV cleaner for their mask for sanitizing.
So I don't use a UV cleaner for my mask, but I don't really wear a fabric mask. I wear the N95 mask, and I wear them a couple of times, and then I throw them away and wear another one. I have seen people talk about using UV cleaners for surfaces. If you hang up your mask and you use what Peter Tsai recommended, which was 1 mask for each day of the week, 7 days, the virus doesn't live for 7 days on a mask. So I think that's probably the best way to do it. I've seen the UV cleaners and I've seen people do that.
Bonnie,
And I
would
should
you like to
probably-
ask your question by unmuting?
I think I'm unmuted, right?
Yeah, you're unmuted. I can hear you.
Yeah.
What about using aromatherapy diffusers? And also, how long should one quarantine after an airline flight from the Middle East?
Yeah, so one thing, let me start first with the airline issue. Ideally, if you could actually get COVID tested, I would quarantine and I would get COVID tested over a period of a week. I'd try to get it more than once. If you're COVID negative after about 8 days, you're probably good to go. Normally people turn positive before 8 days. Again, I would wear this half mask Spirion respirator mask on any sort of flight. There are a lot of airlines that say they weren't selling the middle seat, but they are selling the middle seat, and these airlines are very, very packed now, some of them. Your question about aromatherapy, I don't know that much about the use of aromatherapy.
Can I quickly tell people about my experience? I have flown all over the place, domestically and internationally. I had a family emergency, so I had to actually fly across to Pakistan. And I think airports are really safe because they're empty in most places. The shops are closed, the restaurants are closed. My flights were mostly empty or half empty. There was only one flight where I had somebody sitting next to me. And the airline staff is in spacesuits. So I think that flying is not as bad as people think it might be.
Now, let me ask you this. Did they serve any sort of drink or food on the flight?
So on shorter flights, no, not at all, nothing.
Okay.
But on my long flight, which was a 14-hour flight, of course they served.
Right.
but meaning there were 2 people in my cabin. I happened to be in business class. There were just 2 people there, and these the serving staff was so well protected. I totally felt safe. And most airlines, not domestically but internationally, they require you to get tested before you board. I made sure that I got myself tested after I landed, a few days after, and I continually go and get myself tested so I can continue to live the way I am living, because a lot of it is not really voluntary. I have to do what I do. And so I just get myself tested.
Yeah, so I do think that international airlines are doing better than U.S. domestic airlines. I would actually personally be more scared of a flight from New York to LA than New York to London, right?
I've done that too, by the way.
Have you really? Oh, you're bold. You're bold. I think part of it is what I've noticed is that for me, what I've noticed is that the strategies that they're taking are not consistent. And so because we have this sort of patchwork strategy, even state-wise, I think that's what actually for me is more concerning. If I knew that the FAA was requiring all airlines to follow these policies, right, then I think I would have a little bit more confidence. But what I've noticed from the people that have actually come to my webinars is they have a very different experience if they're on Southwest, which seems to be doing a good job, versus, American, right? And so I don't, without knowing who's who, I don't personally feel like risking it. So that's what I've noticed is that the airlines are very, very different.
What about face shields? How effective are they?
Yeah, so the face shields are actually not as effective as a mask. So they're less than 50% by themselves. They are helpful if you use them in conjunction with a mask, but by themselves, no.
Okay. All right. Are there any more questions? Just unmute yourself and ask directly.
Hi, this is Laura, and I'm asking a question that I think I also saw another person put in the chat, which was about the little carbon filter insert. If we've got the homemade masks, you cited, I think, a 50% efficacy of just the sort of homemade mask. Do the filters help others? Do they help us if we're infected, if we're not infected? What is the, why? and is it worth it?
Yeah. So the filters are helpful. So some people are putting the filters in a vent, right? It's best to use a ventless mask, right? But some people are also putting the filters, like for instance, my Spirion mask has a filter on it, and it helps me breathe better, right? It has an outpour for me, and so my breath is going through a carbon filter, and also air in the other direction is going through a carbon filter, right? So what some of these masks have what they call active ventilation, right? So there's a mask that is getting ready to come out by a company called Leaf, L-E, like a leaf on the ground, L-E-A-F, and it is an active ventilation filter, which means that air is coming in both directions. But the carbon filter actually picks up the virus particles.
Okay, and so then for those of us who are wearing our little sort of, loving hands at home, cute things that are made out of cotton essentially, or maybe a tighter weave, frequently there's sort of is a pouch. It's 2 layers of fabric, but there's a slit in it that you can put this thing in, and then you wear that for whatever, and then you take it out if you're going to launder the mask. So that was the one. Does it have to be tossed after a few days? Can you let that sit out for a week or so and detox?
Yeah, so yeah, though I have not seen that particular contraption actually studied, right? I would personally take the carbon piece and throw it away, and then you can go ahead and wash the fabric piece. But yeah, I haven't seen that. Now I know what you're talking about, the one where it's more like a square mask and they put a carbon filter in between. I haven't seen any studies on that, and I think that's primarily because I'm not sure if there's other countries. You know, we're kind of the only ones that have gone into this hokey homemade thing, right?
Well, the study about the gators is so depressing because
Yeah.
I think that we're in a safe space here for me to just say it, but it feels like sort of the toxic masculinity of dudes not wanting to wear a mask. They feel like it's cool to wear the gator, although like NFL coaches on the sidelines are wearing those, and it's simultaneously hilarious and horrifying that apparently those actually make it worse. So I was wondering if since they're studying those things that seem to me like a preposterous solution, like it's a turtleneck that you've pulled up, that maybe they had also done some studies on these carbon filter inserts, but it sounds like we just need to wait for more research to happen.
Yeah, that study actually did look though at the homemade mask, and they looked at the fabric that's best. And so it's best for the homemade mask to be made out of 100% cotton. So they looked at all these different cotton wool blends, etc. And the other thing that they found was 3-ply was, it was important that it at least be 3-ply, and 5-ply was best. So that's what they, but they didn't look at the carbon filter piece.
There is one more question about masks that say 95%. Are they the same as N95s?
Yeah, so the N95 and KN95, anything with that number at the end means that it blocks 95% of the particles if properly fit tested.
Ah, there you go.
I just want to add that in, if properly fit tested. So without proper fit testing, it may be, 90% or something like that. So it's not like you shouldn't. It's still much better than the surgical mask or the homemade mask.
Nancy wants to ask one more question. Go ahead, Nancy.
So at the risk of overstaying my new welcome here, but 2 quick things actually. For the temperature checks, personally, I feel they're worthless because people can be asymptomatic, and that's what I've been telling people, so I'm not lying.
Yes, you're not lying.
Thank you.
I tell people don't even bother to do them.
Yes.
You're giving yourself a false sense of security.
Exactly.
Asymptomatic people don't even bother to temperature test. Yes.
And then second question is, as you know, we are fully open now. The governor has opened us to 100%, and we have schools have been mandated also 100% in person for most of the state. I've been anxiously watching and waiting for the numbers to start growing, and so far it hasn't happened. Do you think, I'm just wondering what you think might be going on. I sort of feel like the people who are asymptomatic fly under the radar, and it's getting out there, and it's out there, and we just don't know because no one's getting tested. Do you think that's what's happening, or is it just dumb luck, or just curious?
I've been kind of curious as to what the schools are doing in Florida. So do you know what they are doing?
So in different counties are different, but so we had a phased in where we had 2 days a week for the high school, 3 days a week for the middle school, and 5 days a week for the lower school starting August 20th.
Okay.
But as of September 14th, it was mandated everyone had to go back 100% brick and mortar or they would not get their funding. So it is pretty widespread now that schools are back in session. And as you know, the colleges here are, it's crazy.
Yeah, so if that happened as of September 14th, you just haven't had enough time, right? You're going to see all of those cases. You're going to see those cases right around the middle of October. Yeah, right in the middle of October, right before Election Day. You're going to see those cases. What we found is that with the kids, the ones that are less than 7 or 8 seem to do a little bit better, only because they're more like directly under a teacher's supervision, and like they might be in one class for the whole day, right? So that teacher then makes sure that everybody keeps their mask on, right? Once you get to like 9, 10 years old, they may be switching classes, they may take their mask off. They're not as much under direct teacher supervision. Those kids are 10 to 25 or so. Those are the kids that are actually really getting sick, and I think you're going to see it right before the election. I wouldn't call it a success, and I don't think it's going to be a success.
Believe me, I don't think so either. Yeah.
But what's
One
important?
more question.
Wait, can I just say this? Well, the other thing too that's important about the kids is that in certain areas where we've been running out of capacity at the adult hospitals, we have been using some pediatric beds as sort of like our overflow. And if you then open up schools and the kids start getting sick, you really, really can jam up the healthcare system pretty terribly.
Courtney, you want to go? You may want to unmute yourself, Courtney. Okay.
All right, is that her?
So if there are no more questions,
Let's see.
our sincere thanks to
Okay.
you. You've blown a lot of myths.
Can I
And you have
interrupt?
reassured
Oh,
some
you've
of
got,
us, and you
we've
have
got somebody
frightened
who,
some
we
of
got
us.
somebody, we got somebody who wants to, admin iPad Michelle.
Right, thank you. I just wanted to recap that your video is available, like a video of this or similar is available publicly. Are you on YouTube or where is it available?
Oh yeah, so I don't know, Amy, I don't know where this video will be. Amy, do you want to say where this video will be?
Sure. We make this video available to our members on a members only portion
Okay.
of our website. But I can also send it around to, for folks participating today, I do share the link. So that way people do have a record of what they participated in.
Right, I am a member.
Too. But it'll become it'll be a YouTube video, and it will be up on the website by Saturday.
Good. The second
All right,
thing.
and then mine are on my website, which is askdrv.us. So all of mine are on my website, and all of them are also on YouTube, and they're dated going all the way back to February.
Dr. Crowder, we had a question. Ellen suggests that we share your slides as well. I just want to get your okay.
Oh, that's fine. Yeah,
okay,
that's fine. Yes.
Thank you.
Yep.
So thank you so much. We would, we really thank you for everything that you've done, because you've dispelled a lot of myths and you've actually put the fear of God in a lot of us. So, so I think that's all to the good. We all need to be a little scared, because this is a very scary time and it's a very scary disease.
Yeah.
So on behalf of all of us, thank you for doing this.
You're welcome.
Thanks a lot.
Thank you. All right.
Thank you.
Thanks,
All right.